Thank you. Good morning, everyone. My name is Lori Watts. I am the Associate Director of Development for the American Cancer Society here in New Orleans. Our organization is comprised of a few different pillars. I'm going to be joined here today by my colleagues Jasmine Watts. She is the Associate Director of Community Partnerships. Alice Klein. She is a member of our ACS CAN Cancer Action Network arm of our organization in charge of government relations for Louisiana. So today we've divided up our presentation into three different sections. First, we're going to be talking about Voices of Black Women, which is a cohort study. Jasmine's going to be able to go into depth on that. And then Alice will be sharing with you our Cancer Action Network initiatives going on right now. And then we'll also be ending just with an overview of what we have going on statewide for this year in terms of events, which increase our awareness and reach in the communities throughout the state. And so first, I just wanted to share with you all this graphic here. This is what we use to report on the impact made in the state. Each year we gather the information from the prior year. So in January, we'll put this together. And so this shows the three different pillars: advocacy, which again is the Cancer Action Network arm. Alice will go into that. Research is the other biggest part of our organization. We are the second largest funder for cancer research next to the federal government. We actually have 4 active research grants in the state right now. And so last year alone, we had over 3 million in cancer research grants in the state. And right now, I believe it's over 4. And then lastly, the patient support pillar, which again is what Jasmine is a part of. She'll be talking about voices, but as part of the patient support pillar, we work with hospital partners around the state, around the country for that matter, but around the state, you'll see the impact that was made to Louisiana residents in 2024. And so the patient support programs, some of them that we have are the lodging grants, which are through Hope Lodge. Those are around the country. We have one over here on River Road. And so the state, the Louisiana residents were able to access those lodging opportunities across the country. So the number here is showing you over 12,270 free nights to Louisiana residents specifically. And then the last information on the page there on the bottom is the rides to treatment. This is provided in several ways. Grants go to hospital systems to use as gas cards, lift vouchers, and public transportation passes. And we also have a volunteer program where people provide rides to treatment. And last year alone, 2,770 free rides were provided just to Louisiana residents alone. So I just wanted you all to have this information in front of you. Oh yeah, thank you so much. And so now I'm going to introduce Jasmine Watt. She's going to come up and tell you more about the Voices of Black Women program. Jasmine.
Hello, everyone. My name is Jasmine Watts. I am Lori's cousin. I'm just kidding. But I'm the associate director for the patient support pillar, working with community partnerships. So we work with federally qualified health centers as well as hospitals and health systems to help them, get access to screening, introduce to screening initiatives if they need assistance with that, and so much more for their patients. So I'm going to talk about the Voices of Black Women today. It is one of the leading research. Oh, I didn't hit the next button. There we go. All right. So it's one of the leading research for decades that American Cancer Society has focused on. Voices of Black Women is very new. So we're focusing on a population cohort study, and it'll contribute to understanding how cancer develops in a population, identifying cancer risk and factors, learning how to improve survivorship and outcomes following a cancer diagnosis. Finding these findings from the studies will provide a basis for cancer prevention and control programs and the services. So it'll go all in to assist and guide us in the work that we do day to day. So we are consenting a large group of cancer-free people. So individuals who have cancer cannot participate in the study just yet. Collect survey data and specimens, which will be optional. Follow these people over time for outcomes and updated data, and then the cancer risk survivorship and survival research will be presented out of that. So the years that it started, Voices, of course, is the new arm of it. 1952 to 1955, there were a little bit 188,000 participants and 22,000 volunteers. From 1959 to 1972, We had 1 million participants and 68,000 volunteers. So as you can see, the increase in the flux that goes and happens over time. 1982 to 2002, there were 1.2 million patient participants and then 77,000 volunteers. And then 2006 to present, we currently only have 304,000 participants and 25,000 volunteers, but we hope to increase that to help build that arm out and so that we can streamline our focus in the patient cohort and seeing what the outcomes will be. In 2024, the American Cancer Society expanded and went to this cohort, which is the voices of Black women. So, envisioning the study. So, the local focus group of Black women is the essential focus, and then community input and engagement is where we're focusing. The basis of it, so that'll be the foundation of it all. So with community engagement, of course, we have our voices and ambassadors, which will be our volunteers, people who go out to recruit people for this the surveys. They're trained, and they are basically those community advocates, so we could look at them as like community health workers. And then you have the organizational engagement, so we have national and local partnerships with Black civic and faith-based organizations, health systems, community organizations, sororities, fraternities, things of that nature to capture the African American population. So it's very transparent. It has rigor, accountability, and impact. And the main thing I'm going to focus on here is like the impact of it, because at the end of the day, that's what we're trying to do, to drive the impact deeper so that we can eradicate and erase some of the cancer disparities. So, Black female scientists with expertise in Black women's health is who is studying this. So they're on the scientific advisory board, and then the de-identified data. We have those internal researchers, ACS researchers, population science team, and scientific partners. As Lori mentioned before, like we have a good bit of researchers across the country who are involved in different types of pieces, but just for this, we looked at scientists who focus on Black women's health. So our co-principal investigators are Dr. McCullough and Dr. Patel. And so we have some external researchers as well, investigator-initiated funding opportunities that came through ACS for this. And you can learn more about this through how we connect with the community and impact the community on our website. So here's the study team. So you can see the study leadership is made up of women of color. So we have Dr. Patel, we have Dr. McCullough, we have Dr. Terrace, yes, and then we have Jashandria McCrae, Elizabeth Kirkland, Eunice Labry, Ms. Bontemps Jones, Holly Vins, and Jessica Gerald. And then we have some participant communications. So we have Tiffany Patterson, Emanuela Messine, Bijan Cook, and Aaliyah Green. And then we have our scientific advisory board, which is made up of those doctors that we focused on earlier. Health disparities among Black Americans. Overall life expectancy for is much lower for Black versus white individuals. So for women, we see a 77.9 age group for African American women versus 81 years of age for white individuals. And then for men, it's 71 for 0.5 for African American men, and then 76.1 for white men. I'm sorry. In 2016, the death rate in the U.S. was higher for Black than white individuals for most chronic conditions. Here are some profound impacts on cancer survival as well. So cancer, heart disease, stroke, influenza and pneumonia, diabetes, hypertension, HIV/AIDS, kidney disease, and homicide. A large-scale cohort of Black Americans would have been substantial value even beyond cancer. So as we look at all of this, we're collectively looking at the data. So all of the chronic illnesses that African Americans face and the women that are facing this, as well as life, so the social determinants of health, we're looking at all those pieces, coupling it with cancer diagnosis. Collectively, Black individuals have the highest death rate and the shortest survival rate of any racial group in the U.S. for most cancers. So what's driving the disparities? Why do U.S. cancer health disparities exist? So there's a bunch of complex factors, which I kind of just went into, but you can see a visual on the slide. So we have environmental factors, then we have behavioral factors, and then we have the social factors, clinical factors, cultural factors, psychological factors, and biological and genetic factors, which is like way down the totem pole, right? Because we have to look at it. Where people live, work, and play also plays a part in what their health is. Because if I have to sacrifice going to work today or picking up my kids or feeding my family to go to a doctor's visit, that I can't afford already, I'm not going to go to that visit, right? So it's about making these things happen in real time. How can we meet the people where they are? And so understanding which combination of factors contribute to this, to which disparities will facilitate our understanding of how to eliminate them. And so this is like a big thing about, storytelling. So this survey and the cohort will learn a lot of things from storytelling. I just share a personal caveat. I was diagnosed with lymphoma in 2023. When I was diagnosed, I got the diagnosis on my chart. They didn't say anything else about it. They just like, and my doctor was so apologetic about it. Then I was referred to an oncologist. The oncologist said to me, this cancer is aggressive, it's stage 4, and you're gonna die if we don't start now. And I'm like me? What are you talking about? And so it took all of that. And so I quickly had to switch. First, we're human. So we like get into ourselves and into our heads. And next thing I know, I'm like texting my colleagues like, hey, anybody like at any hospitals in the area that can help me do X, Y, and Z. And so we move forward from there. But think about a patient that has to go through that and they don't know which way to turn. Their job is not so, is reluctant to listen to them and understand them. We hear stories about patients saying, they say I don't look sick or I don't feel like anything. What does cancer look like? We don't know what that looks like. So this cohort in this survey is what we're driving forward to try and figure out those things, to try and figure out these disparities, to get people past those pieces. The path to engaging 100,000 voices of Black women, enrollment is open in all states now. So the Voices of Black Women will recruit Black women between the ages of 25 to 55 with no cancer history, and then they must reside in the United States. We have a little video here.
For too long, Black women have suffered disproportionately from rates of cancer and other diseases, and with very few exceptions are more likely to die of cancer than any other race or ethnic group.
This study is entirely what we call observational. You are sharing with us how you live, what you do, what you may be exposed to in your life, and we're collecting that information from you.
Voices of Black Women is really to dig into that lived experience of Black women. We dig into aspects around trust of the medical care system. We dig into experiences of racism and discrimination and where that comes from.
You're telling me if I give you this information, it might give you insight into why we are getting cancer at higher rates, why we are dying at higher rates. I feel like it's an easy ask when you look at it from that perspective.
Everything that we're going to learn is going to impact Black women's health for the better. This is more than a health survey. That's why we call it a movement.
So the eligibility for the Voices Enrollment Survey is less than 5 minutes. It ensures that the participant meets the criteria to join Voices. Then it's an informed consent. That's 10 to 20 minutes. It ensures the understanding of the study participation. And then the registration of the survey takes about 10 to 15 minutes. It ensures Voices study team can follow up with participants. And then we have the Life and Health of the History Survey. It's about 60 to 90 minutes. The data collected here covers a broad range of topics. And then there's 2 annual follow-up surveys. Only 1 hour a year can make a lifetime of difference for generations of Black women. I'll now bring up Alice, my counterpart, and she will introduce you all to ACS CAN. Thank you.
Thank you, Jasmine. My name is Alice Klein, and I am the Louisiana Government Relations Director for the American Cancer Society Cancer Action Network, ACS CAN for short. So we're the 501c4 nonpartisan advocacy affiliate of the American Cancer Society. So the American Cancer Society has been around for over 100 years doing incredible work. But in 2001, they decided they wanted to be able to do more in the advocacy space. Like if they're really going to make a huge difference in the fight against cancer, we need to be able to influence our lawmakers. So they created ACS CAN. We're nonpartisan. We do not give any donations to candidates. We don't endorse any candidates. Everything we do is through the cancer lens, and we only support evidence-based policies that we know will benefit cancer patients and their families. And we have volunteers and staff around the country. We have a government relations director in every state. We have a grassroots manager in almost every state. And then we have a whole team of federal lobbyists and policy people. So on the federal level, here's a list of our priorities for the first 100 days of the new presidential administration. So we want to make sure that funding for cancer research at the NIH, NCI, CDC is protected and maybe even increased. Like Lori said, ACS is the biggest funder of cancer research behind the federal government, and almost every single major breakthrough in the fight against cancer can be directly traced back to this funding at NIH. So we definitely, these cuts that, they're considering at the federal level, we're fighting those and trying to convince Congress that they need to actually increase our investment because we're on the cusp of so many breakthroughs and we don't want to lose any of that progress. One other thing we'll be doing is trying to convince Congress to extend the ACA enhanced tax credits. I think y'all are going to learn a little bit more about this later today in another breakout. But during the pandemic, healthcare premiums really skyrocketed. And so Congress passed tax credits to go towards the cost of Affordable Care Act marketplace plans to make those plans more affordable for those beneficiaries. Unfortunately, those tax credits are scheduled to expire in August 2025. And if that happens, healthcare costs for people on those marketplace plans will absolutely skyrocket, and a lot of them will no longer be able to afford health insurance. So we're trying to elevate that issue with them right now. We'll also be trying to protect the Medicaid program at the state and federal level from any types of cuts or policies that would hinder people's access to the program. The Medicaid program is so important to make sure that people can access screenings and preventative care and get care for cancer when it's more treatable, rather than, a lot of people who don't have insurance, they just show up at the emergency room when their situation is really dire. And a lot of the times at that point, their cancer is too far gone, it's expensive to treat, and it's just, it causes a lot of stress on the system. So we want to protect the Medicaid program as much as we can. And then lastly, we'll be trying to convince Congress to pass the Medicare Multi-Cancer Early Detection Screening Coverage Act, which we call MCED or MCED for short. So there's several academic institutions and pharmaceutical companies who have recently developed multi-cancer early detection blood tests that can test for a ton of different types of cancer in one simple blood test. And a lot of those cancers are ones that don't have regular screenings currently. So this is a huge breakthrough. And this bill would make it so that the Medicare program could figure out a pathway to coverage for their beneficiaries so that when these tests get approved by the FDA, Medicare beneficiaries won't have to wait around to figure out if they can afford to get access to this test. And we actually had an advocate meet with Senator Cassidy's office on Monday, and then he signed on to the bill as a result of that meeting. So we're excited about that. So every year we have a federal lobby day. We invite volunteers from all over the country, usually over 700 volunteers from every congressional district, to DC to meet with their lawmakers and explain to them why they need to make cancer a top priority. We give them a training on how to most effectively share their story. And here's a picture of us with Senator Cassidy a few years ago, and then some volunteers from other states. And so that happens every September. And so I'm not sure what our priorities are going to be by the time September rolls around, but hopefully we'll be in a good place. And so then on the state level, as government relations director, it's my job to educate and lobby our local and state officials on cancer issues. And it looks like the slide got a little messed up there, but I'll read it to you. So some things we work on are cancer prevention and early detection. Our state government funds the Louisiana Breast and Cervical Health Program and the Louisiana Tumor Registry, which are two incredible programs that are run by the LSU Health Sciences Center. They're two of the most highly ranked programs of their kind in the country. And they receive money out of our state budget. And so we always want to make sure that those funds are protected because they draw down a federal match based off how much funding they get at the state level, and we don't want to miss out on that money. And the breast and cervical program provides breast and cervical cancer screenings to uninsured or underinsured women. And then the tumor registry collects data from cancer cases around the state to help inform cancer researchers. So they're both really important programs. And then we also are always working on reducing the toll of tobacco. Unfortunately, tobacco use is still the number one cause of preventable death in this country and in Louisiana. So in 2006, the state legislature passed a law to eliminate smoking in all public workplaces, but they left a loophole for bars and casinos. So since then, we've been going around to local governments asking them to close that loophole, and over 30 municipalities in Louisiana have already closed it and eliminated smoking in bars and casinos. We were influential in leading those campaigns in Baton Rouge, Shreveport, New Orleans, and we don't plan to stop until the entire state is completely smoke-free. And it looks like this year we might be talking to the legislature about potentially raising tobacco taxes, which will hopefully lower tobacco use rates, and then the state can invest that tax revenue back into evidence-based tobacco control programs. So we'll be talking to them about that. And we'll be having our state lobby day on May 7th. And if you're interested in joining us, you can scan that QR code. It's completely free to participate. And we provide a training on how to talk with your legislators. It's a great way to network with them. And yeah, we hope you'll join us. And I think I'm going to invite Laurie back up to close this out.
So now I just wanted to share a little bit about what we have going on statewide this year. Our events range from community-style events that are more of a festival style to galas to young professional events. Also, we have golf tournaments. These are ways for us to engage with our communities, increase awareness, increase volunteerism. And so I just wanted to share with you our timeline in case there's something that interests you. On the last slide too will be our contact information should you like to get in touch with us about any of these. So our longest running fundraiser, Relay for Life, this honors survivors and caregivers. It typically started as a 24-hour event. It's now a much shorter program, and this is going on its 40th year nationwide, and in Terrebonne Parish it's actually celebrating its 30th year in Louisiana, and it's one of our top events across the country. So these are some images actually from the Relay for Life events across the state. Those dates there on the screen, and they're all coming up next weekend actually. And then next on our timeline is For Cancer. This is a young professional event in Baton Rouge taking place May 1st. This invites young men and women to sign up to be ambassadors for the organization, raise funds and awareness, and they celebrate at this event, which involves the restaurants in the city of Baton Rouge. Men Wear Pink. This is a national campaign. This is our breast cancer research. It specifically raises funds for breast cancer research grants and breast cancer patient support programs like the Reach to Recovery program, which is a mentor-mentee program that we run for breast cancer patients to be paired with a survivor who's undergone a similar diagnosis. So these men here on the left are New Orleans from last year, and on the right, these are the men from Southwest Louisiana, the Lake Charles area. So nationwide, but we have two campaigns here in the state. Black and White Gala in Lafayette, one of our longest running events in the state as well. And so that will be in August. Here in New Orleans, Cure by Design, we're celebrating our 25th year. This gala got started as a way to fund the Hope Lodge on River Road and continues to help fund the operational costs and special projects at the Hope Lodge to keep everything up and running. And so that'll be on November 27th at Mardi Gras World. And that's 10 men and 10 women also that are advocates for the organization, and they raise funds. And it's a great event. That's actually how I got started with the organization. I was a volunteer for them, and then they recruited me to work for the organization. So Cattle Barons Ball, we launched one last year in Ascension Parish. This is a more casual kind of gala feel, country western style. It's actually started by American Cancer Society in Dallas, and now it's in several other states as well. It's a lot of fun. So Ascension started it here in Louisiana, and now we are launching one in Southwest Louisiana as well, and those will be November and October. Inaugural Golf Classic at TPC will be taking place in November. We have a kickoff actually later on in April, and I can get you information about any of these. Oh, and lastly, Shuck Cancer. This is our biggest young professional event. It takes place at Champion Square. It's always the Thursday before Thanksgiving, and it invites young men and women to, again, be advocates for the organization, raise funds specifically for transportation and lodging grants in the state of Louisiana. This event launched here in New Orleans. It's now in several cities across the country where oysters are known to be prevalent. And so they have oysters brought in from all different parts of the country, and they have everything donated. It's a great celebration. It's about 1,000+ people. There's also non-oyster cuisine as well. And this is our contact information slide should you want to learn more about events, the Voices Cohort Study, or ACS CAN. I invite you to take a picture of our contact information. Thank you all for your time today, and I just wanted to open it up to any questions that anyone may have.